Hey, it is officially day 7. Week 1 is officially checked off. Hi, my YouTube subscribers. Hi to those that just are watching this video, have searched and found this video. I am Kari. This is my journey to healing, walking, and living better after having a flat foot reconstruction surgery on January 21st, 2022. I am officially again at day 7, 1 week down, weeks to go through this journey. But I just wanted to come to you guys. As you see, I'm in my bed still, can't really do much. I'm moving a little bit more, only in the sense of I'm moving a little bit quicker. I'm not putting no pressure on my foot. You can't put any pressure. I feel better. So if you go back and you see some of my previous videos, I was a lot more medicated, very drowsy. I just tried to do a little something to my head since I can't get it done right now at this moment. Can't really do much. So, I tried to look okay for the camera, for y'all, for the video. I wanted to look like some, put a little earring in, not much, just something I found because I can't go upstairs. My house is upstairs, downstairs, so I'm having to sleep in my guest bedroom downstairs. Because you can't put pressure on your feet, on your foot, I should say. One thing I would say, I've met several people, talked to several people who've had surgery for some odd reason on both their feet at the same time. They couldn't have had the surgery I had because there should be no doctor out there recommending to have a flat foot reconstruction on 2 feet at the same time. You have to have some sense of mobility. Unless you are okay with being bedridden, having diapers on, all that stuff, I'm not interested. I already don't like the fact that I got a bird bath, plus size woman. Even if I want plus size, I just think that's nasty. You need to be able to take a bath. And that has been challenging. Just to know I can't get into a shower. So today what I decided to do, you know what? I'm not just going to lather that washcloth and I'm going to actually take that washcloth, have it completely soaked. I don't care how wet the floor gets. I'm just going, like I'm in the shower. Throw a whole bunch of water, make myself feel like I'm in the shower. And when I tell you guys, I feel so much better. It's all a mind thing though, right? But to know that that water was like on me a lot and I'm lathering and feeling like I'm kind of in the shower, what this teaches you is survival. It teaches you to do things that we take for granted, that we don't do, but you find a way or make a way. And I went to Clark Atlanta University, and one of our mottos was find a way or make a way, path of pride. And so that is the way I came up with to take my shower today. As I stated, if you go back and you look at some of my previous videos, I was drowsy. I wasn't as vibrant as I am today. You would definitely tell a difference in my videos. And as time goes on, you will see change. And that's what I want you to see, because I want to be able to show you the progress in the journey from as many different angles as much as possible. Because if you are considering this, if you know someone that's considering this, I want to be able to inspire you, motivate you, and encourage you to move forward with it and not be afraid. It is scary, but it is a risk, a good risk, that I encourage anyone to take as long as you have the right doctors. And the most important thing outside of the doctor is the right support system to take on and tackle this journey, because it is a mental journey, it is an emotional journey, and it definitely is a physical journey. And I could not be where I'm at right now 7 days in if it was not for the support of my family, my parents, my sister, my 10-year-old son, my amazing guy friend, my best friend, all my sisters that aren't blood sisters, all of my friends, people that just have either showed love in some way to bring me food, me and my son food, to just check in, make sure that I'm okay. Everybody, and so you need that, because that is important. And I'm a lot more vibrant because I've decreased my medication. And some people may be like, oh my God, 7 days in, how's your pain? So the way that my pain is working right now, my pain is at its worst when I put my foot down. It's uncomfortable when it's elevated as well, because now I'm dealing with the itching. I'm dealing with the discomfort from where the incisions are. And then I'm trying to be mindful how I turn my foot, because the reality is I can't keep my foot straight up 24/7. So in the way I sleep, you want to still be comfortable, but you still want to follow the instructions. So I kind of turn my foot, turn it this way. I lay down sideways. I've tried to make it work the best way I can without doing the most important instruction of them all, not to put any pressure on my foot. And I feel I have done a good job in the last 7 days, still needing to take it easy, making sure that I don't overdo it. Going to the bathroom, like I said, is very challenging. However, my father bought me a toilet seat. So I recommend that if you don't have a high toilet, I don't have high toilets in my home. So I recommend that you get a high toilet seat, or you get a toilet that's portable that you can sit on. The only thing about that, if nobody's willing to clean your urine to pull it out, I wouldn't recommend it if you can't directly flush it. So my best recommendation and suggestion is to get a thick high-rise toilet seat that can go on top of the toilet. That way, when you're going to the bathroom, you're not sitting so low. You're not scared to put pressure on that injured surgery foot. You kind of have an easy breeze. Of course, you're having to hold on to stuff because you still can't put anything on that foot to sit down. And that's kind of how I've been doing. Another thing that I recommend that I don't have, my bathroom is very tight because I am downstairs. I don't have a full downstairs. I only have a half bathroom and it's small. Most half bathrooms are not big. And you got to remember, I'm taking a knee scooter in a small bathroom because you can't put no pressure on this foot. You don't want to because you in pain. So I encourage anybody, if you can, rent or buy one of those. It's like a handle thing. You see them. Let's say like at the emergency you know how when you go into the bathrooms in the public places, they got the silver railing and stuff for more so like your handicap, except this is going to be close to the toilet. So on top of your high-rise toilet seat, I recommend that you have that. I don't have that. I was looking for one. Excuse me, y'all. Put my foot back up on the bed. I don't have that, but I do recommend that you get it so that you can have something to hold on instead of the wall, putting your fingers on the wall, because that's what I've been having to do. And then put my knee up on the knee scooter. You want to have a knee scooter. You also want to have a rolly chair, an accessible rolly chair, because there's going to be times where if you're on a main level, you're not going to want to necessarily be on that knee scooter all the time. You may need to go to the kitchen, to the sink. And remember, you're tired more because you're limited on your usage of both your feet. Because remember, the feet is the foundation of your body. And I commend anyone and admire anyone that has lost a leg or a foot. I cannot imagine the challenge you have faced and endured, the strength, the willpower to press on losing a limb, because in this 7 days of not being able to utilize both my feet has been an emotional, physical, and mental process and challenge. I'm blessed that I'm still able to use it once I get past this healing part. But to know and to think about that during this process, that things could be worse and they're not. And imagine those that have lost their limbs and they're having to learn how to live without it, how to get a prosthetic, All of those things have gone into my mind, so I commend you on that. So get the rolly chair as well. That's the recommendation, because it makes it easy sometimes when you just need to not get on the scooter. You kind of just have to glide yourself with that one foot, but you're relieving all of that pressure. You're not feeling so tired. Also, I recommend it's a certain pillow that you get off Amazon. And I got that off of another YouTube video that I recently watched this week from a young lady that had the foot reconstruction, had flat foot surgery, I believe. It's like, I can't remember the name of it. It's like a pillow tower. And it's about $32 to $39. You can find it on Amazon. And I'm waiting on mine to come in, because what you will find, the pillow way is not the way. Your pillows are falling. Pillows are everywhere, because you got pillows to sleep on, pillows to try to elevate. If you get this thing, I'm hoping that it works. I haven't tried it. I will let you guys know at a later date and time. But based off the reviews, based off the video from this young lady, this was the recommendation, because they were having the issue that I'm having. So that is something else that I would encourage anybody else to do, and get these things before the surgery so that you don't have to go through this. Again, the point of doing these videos is to help someone else, encourage you, motivate you, but also give you things that people that have already been through this process, have learned along the way, and the do and don't list. I also encourage you to have ibuprofen on deck, over the counter. You will be prescribed medication. The medication usually prescribed by your doctor is an opiate type medicine, which can be an addictive based medication. It makes you very sleepy. You don't want to get too dependent on it. And so for me, I'm not a big pill taker anyways. And so I offset it with ibuprofen, which actually helped. Because in this, what you will find, most doctors, I can't speak for all, but my doctor did what you call a nerve block. That nerve block was injected in me during my surgical procedure, so that when I woke up and went home, it helped with the pain. Now, with the nerve block, it removes all of your nerve feeling for up to 48 hours. It is the worst pain you could possibly have. Imagine your leg trying to explode. Imagine your leg, you losing the circulation out of your wherever. That's how that feels. It's very tight. It's uncomfortable. You're swollen. It hurts. It's painful. But what the benefit of the nerve block is to remove the excruciating after effect pain of the actual incisions. That is what I'm blessed for, because now what I'm dealing with is the pain of the actual incisions. Like now I'm having a sharp little pain, so I'm doing this. And my biggest pain comes when I put my foot down and it feels like all of my blood is rushing to my foot. It is so painful. But again, I'm not saying that to scare you. I'm preparing you, because I wish that I would have had more videos to show me these things, to tell me these things, to better prepare me. Sometimes it's best if you don't watch these videos. I get it. You just kind of have to go and learn. But I also believe in you helping somebody else prepare so that they know what to expect. And I think I did pretty good with preparing myself. I set up my room downstairs, my guest room. I had my towels, my body wash, deodorant. The only thing I did not do that I should have done for my ladies, men is going to be a little different. Ladies, when you have this cast on your foot, it is pretty big. Mine's is big. You cannot put no pants on unless you probably are doing like a super wide leg pants. That is the only thing I did not prepare for. I bought leggings downstairs. I bought t-shirts that weren't long. That part, no. You need dresses. You need long pajamas that are loose and comfortable. Of course, if you have guests to come over, you may want to have like a loose short set. You in the house, so if it's winter like now, it's cold. Have like a short set or something that has a wide leg to get through that cast. Leggings not gonna do it, and that's all I got down here. And I ain't been able to wear not one pair of leggings. Excuse me, t-shirts, dresses, stuff like that doesn't require. And you go to the bathroom, you don't want to have to try to deal with all that, and then you're bird bathing and all of that stuff. So it's just best to kind of dresses, men, wide leg shorts, stuff like that, stuff that's easy to take on, take off. Dirty clothes hamper, just have everything you need. So again, I feel better. My spirits are up. You do have your moments, because I'm here by myself majority of the time now. My mom has been staying. They still want me to come stay with them. If you can have somebody just stay with you, that's good. But if you like me, I do like to have the company. But at the same time, as long as I got TV, my phone, certain things to entertain me, I'm cool with kind of being by myself sometimes. Like right now, it is a little lonely because I've been here all day. My son is gone. My friend, he's getting ready to come over. So, to keep me company. So, I look forward to that just because I can't go outside. So, I hope that this video helps you. Again, this is day 7 post-op. Compared to my last videos, I'm totally different. I'm up. I'm not drowsy. I also mentioned in the previous video that my tongue was numb from, I guess, them putting the breathing tube down my throat doing surgery. That finally has diminished. It's still a little whatever, but it's not as bad. So that you may deal with. Some people may not, but I did. It was very irritating, but it's almost gone, so it's not as bad. Because I was still kind of talking weird. So the process, the journey is going well. I'm excited to go to the doctor on Tuesday because I'm ready for her to recast this thing. It's getting raggedy. It's heavy. I'm hoping she put me in something a little lighter. I know they got to stabilize me, but I cannot stand this thing. It's adding the heaviness. So I just look forward to her being able to remove it. Yes. Not looking forward to the stitches being removed because I heard that hurts. But that probably won't happen for another couple of weeks. Another 2 weeks at least. So, but again, my journey so far is going well. I encourage you to do it. Research is most important. Read reviews on your doctors. Whatever your issue is with your foot, make sure you get a doctor that specializes in that area. Just because it's either orthopedic or a podiatrist, that does not mean that is their specialty. My doctor specialized in flat foot reconstruction surgery. Again, she specialized in flat foot reconstruction. So I didn't go to a doctor that do it but don't specialize in it, right? I went to a doctor that actually specializes in flat foot reconstruction surgery. And she was amazing to me through this whole process. And I just can't thank her enough. I can't thank the team of medical professionals at the hospital I was at. The office of Dr. Adrian Ross with the Foot and Ankle Institute of Georgia just has been phenomenal. Thank you guys. Thank you, Dr. Ross. So anybody in Georgia looking for a particular podiatrist, especially in the metro Atlanta area, towards the east, I recommend Dr. Ross. But again, I will check in with you guys Tuesday, which will be after my first official post-op. appointment and let you know how things went. Bye.